Good day. This is again a very short session. It was on a NEET recall, and the question was very targeted. Why kidneys are slow to correct acidosis? Now, this is a very physiological question. I try to bring in some clinic into this so that you'll be able to remember the concepts better. So you need to know the basic physiology. How do you eliminate acid ions? Through what, where, how, and how long? And one clinical scenario. Now, some very basic stuff. Cellular metabolism will always end up putting acid. Even if patient is in alkalosis, either respiratory or metabolic alkalosis, his cells which are thriving will be still putting out acid, or rather they will be having a big carbon dioxide load. This is the end point of respiration. You cannot deny that. How do you get rid of it? One, you can take it to the lungs and get rid of it, or this can dissociate into a hydrogen ion, which is again an acid ion. But this will need kidney for elimination. So what I want to tell is all cellular metabolism will end up as an acid. It will never end up as a base molecule or a base ion. Whether the patient is in alkalosis for whatever reason, still they'll be secreting, they'll be only ending up loading with acid ion. Now, as you know, it's the end point of all cellular metabolism. Now, the CO2, it is carried as bicarbonate. 80% is bicarbonate. Dissolved in the plasma is only 10%. Carbaminohemoglobin is again only 10%. So what can happen? This can break down into hydrogen ions. This will, I will tell you in the carbonic anhydrase. This will combine with water and release hydrogen ions. I'll tell you that equation again. Not only that, this can again get converted back to CO2 and get eliminated through the lungs. These two can only get eliminated as CO2. So I want this to be little more clarified. So the question was, why don't look at both the diagrams? They can be terribly confusing. I had to read it 2-3 times to understand, even though we are repeatedly handling patients with acidosis. And if you look at it, acidosis, and that too metabolic acidosis, is the most common acid-base balance in the surgical practice. For that matter, most common acid-base balance in medicine. You might get respiratory acidosis in the pulmonology wards where there is a serious respiratory issues, or you might get respiratory acidosis following trauma, lung contusion, etc. Metabolic alkalosis, where you will get in kidney problems, drug induced. So respiratory alkalosis is little very difficult to find also. They are there when the electrolyte balances have come in. Patient is losing acid. They are the ones who will have a metabolic alkalosis. So please keep this in mind. Or very rapid breathing. They may go into metabolic alkalosis. Let's not go into too many of these acid-base balances. Let's stick to metabolic acidosis, most common anywhere in the hospital. Because of sepsis, because of hypoperfusion, because of hypovolemia, cells are doing anaerobic respiration, and actually acid ions will build up. For the same energy evolution or for the same energy synthesis, they will be releasing more of hydrogen anaerobic metabolism. They will move into anaerobic metabolism and ultimately release more of acid ions. Now let's have a look what is going on in the lung. If you look at the lung, I told you most of the carbon dioxide will be going as bicarbonates. So they are all traveling in the blood. Now this bicarbonate will ultimately break down and lead to a carbon dioxide which can get released into the lung and go into the atmosphere. It's as simple as that. The dissolved carbon dioxide will again find its way. The carbaminohemoglobin will dissociate and CO2 will move. But these bicarbonates, when they have to be made into carbon dioxide, which can leave the body, they will be releasing hydrogen ions. Fine. It is as simple as that. They can combine with the hydrogen ions and form this carbonic acid, which will again break down into water. Both of them, one can get eliminated and the rest will go to the total body water pool. Now, if you look at it, it has taken the whole bicarbonate in just one single step, managed to convert it into a carbon dioxide which can leave the lung, and water. It is neutral. It will go to the total body water pool. And it has managed to get rid of the waste products of metabolism. But look at the kidney. There is a proximal tubule, there is a collecting tubule. What does it do? It will eliminate hydrogen ions, which are acid ions. At the same time, it will absorb bicarbonate ions also. See, the same blood which is going here will also be going here. See the basolateral membrane. So, the same bicarbonate, the same dissolved bicarbonate will get absorbed, but here also it will get absorbed. They are base ions. The body needs them for pH balance. But what kidney can do, it can also use ammonia. See, from this amino acid glutamine, it has used ammonia, and that has to break down properly. As ammonia ion, it can go and take the hydrogen and become ammonium, which is no more acid. So this is how in the kidney there are problems. One, it has to absorb HC3O2. In the lung part, nothing like that. It won't absorb anything. It will only eliminate the CO2. But the kidney has a much more role to play in physiological hierarchy. This is a very quick route. Get rid of the CO2. But here it has to have a very complicated route because it has to be sustained. It cannot go on very quickly. That is why kidney takes longer time to eliminate acid, because it has got many steps involved. Don't break your head with these minute things, but you know how kidney handles acid radicals. One, by absorbing base and by eliminating the acid radicals through your ammonia. There is also carbonic anhydrase here. So if you see, they produce bicarbonates from ammonia. Not only that, with ammonia again they get some more bicarbonates. It's not only the bicarbonates that are there in the blood, they also manufacture through ammonia. They have got rid of the hydrogen ions, plus they have also got a base ion. So it is more complicated and more sustaining because there are many other steps involved. This if you know, and not only that, kidney will be constantly absorbing your electrolytes, your sodium, potassium, chloride, and each time they absorb, they'll be forced to put out an hydrogen ion. And each time they take a bicarbonate, they'll be forced to put out a chlorine. So if you look at it, they have a very complex, beautiful orchestra there. Naturally, a beautiful orchestra will take time. If you understand this, you will know why exactly kidneys are slower than the lungs in eliminating your acid ions. The main thing is this ammonia, because it has to break down the amino acid. It takes time. That reaction is slower than your carbonic anhydrase. Now, let's see. What do? Your lungs, how do they throw out CO2 very fast? How? By rapid rate and rapid breathing. Have a look. This is typical breathing due to metabolic acidosis. So you increase the depth and also the rate. See, rapid breaths. They will blow out the CO2. They will take in enough oxygen, but the main thing here is to blow out the CO2. Now, as I told you, how can somebody is in acidosis for whatever reason? He is in acidosis. How can you use the lungs to get rid of one of the components, which is your CO2? You can increase the ventilatory settings, increase the rate and depth. Like what that gentleman in the previous slide was doing, he was using the body mechanism to eliminate the CO2. But that will not help for long. Body will get tired if he has to take his own breaths. So the ventilator will give better rates and better depths. Fine. Now coming to how do you support the kidney to get rid of acid ions? You can support the renal function itself by giving volume replacement. You give adequate perfusion to the kidneys. They will be able to handle the acid levels. You can give inotropes. This is also a method of increasing the perfusion pressure to the kidneys. A diuretic may help. Now what happens? Diuretics after some time will produce metabolic alkalosis and can cause more issues. So keep all these things in mind. They are very, very delicate ropes to walk. That is where your intensive care can be so detailed, can be so careful. Finally, a hemodialysis, apart from taking out your urea and your water load, can even take out your acid ions. So you must understand how we support renal function to get rid of acid by these methods, how we support lungs to get rid of CO2 by this ventilatory setting. So I've kept it very, very simple. I didn't want to take you straight into the acid-base balance. And you'll be all over trying to find some sense in those lectures. That's why I kept it very particular to the question at hand, which was why acid compensation takes slower in the kidney. I told you the reason, and I also told you the compensation is much, much more sustained in the kidney than the lungs. Lungs will be for immediate compensation. They will just blow out very quickly. When I'm talking about compensation, only from the patient's side, he will quickly try to blow off the CO2 and the kidneys will gear up to throw out the rest of the acid ions. So that was a very brief, it was very targeted against a single question. Keep these concepts in mind. And if you're still inclined, you can always go and read your physiology books. And there is another book which I keep recommending. It's called Marino's ICU textbook. It's by Paul Marino. He will explain in very simple diagrams and very simple language for you to get better grips. And as usual, I will ask you to subscribe, share and like. A lot of feedbacks are coming. And students, I'm so happy that you all are getting some help from me. And please do stay invested. We are there to help you in your journey to get an understanding. And all the time I make sure I bring in some clinical stuff to make it interesting. You should not see, why am I seeing this equation? How is it going to help me? No, it is going to help you in your patient care. And again, thank you for being with me. And don't forget to subscribe to my channels.